Hi everybody, I'm Duto, and today we are going to be performing the peripheral vascular physical examination. As always, we have to wash our hands first, so let's do that. You want to make sure you get a really good lather and wash for at least 20 seconds. Alright, now that we're done doing that, let's go meet our patient. Hello sir, I'm Duto and I'm going to be your provider for today. Can I have you confirm your name and date of birth?
My name is Oge Enyiribe and I was born March 26, 2001.
Perfect. Do I have your consent to use you as my patient today? Perfect. Thank you. So first up, we're going to be noting his appearance and getting his vital signs. Mr. Oge seems to be alert. He seems awake. He seems to have good posture. So from my initial observation of Mr. Oge, he seems to be A-okay. Next, we're going to get his vital signs. Is this on okay?
Yes.
Alright, so the blood pressure I obtained was around 138/78. Alright, and that seems to be relatively okay for someone of his age and the fact that he's a male. Now we're going to be getting his heart rate, and we're going to be using the 15-second method where we'll multiply it by 4 to get how many beats it is over a minute. Alright. Alright, so I got 17, and 17 times 4 is 68. So that means that his heart rate right now is 68 beats per minute. Next up, we'll be getting his pulse oximetry. So we have 97 for his blood oxygen saturation, which is his pulse oximetry. Alright, so we got 97 for his pulse oximetry. Now on to the actual peripheral vascular examination. First, we'll be assessing his arms from the fingertips to his shoulders. So we're going to first note for the size, symmetry, and swelling of both his arms, just from the arm to the shoulder. So can I have you stick out your arms like this? Alright, so his arms seem to be of equal size. There seems to be no swelling. Can I have you turn your arms over? And there is no noticeable difference between the veins of both arms. Next, we're going to note for the color of his skin and the nail beds. Alright, so from my patient's from his physique, you can tell that there's no obvious discoloration. And can I have you stick out your hands just like this? And the nail beds seem to be pale, but not too pale. They seem to have enough blood flowing through them. And then we're going to inspect the venous pattern for prominent veins. Can I have you stick out your arms this time? So all the veins seem to be within normal limits. Alright, my patient has good veins. Alright, so now we're going to note we're going to check my patient's legs from the groin to the toes. We're going to inspect the interior, posterior, and lateral parts of his legs. So first we're going to assess the size, symmetry, and we're going to note if there's any swelling between both of his legs. So my patient's legs seem to be of normal size. There's no noticeable there's no noticeable difference between the legs. There's no swelling either. The color seems to be fine. There's no obvious discoloration. Once again, no bruising or anything like that. And his nail beds seem to be also fine. Alright. No discoloration there or any alarming pallor. Alright, so the distribution of the hair on his lower legs, feet, and toes is what we're going to be looking at next. As my Patient is a male. He does have hair on his legs that he does not shave off. So the hair seems to be, it's not sparse, it's relatively full and thick, and it seems to be just fine. All right. Okay, so next we're going to inspect the leg for any varicosities of the veins, which is basically just like enlarged veins that are bulging. So can I please have you stand? All right. So can I have you walk up a little bit? All right. So my patient seems to have normal veins all around. Okay. All right. Thank you, sir. You can have a seat. My patient has normal veins. There's no veins that are enlarged or bulging. He does have some veins that are a little bit raised on his feet, but that's normal. There's nothing that's alarming about that. And now we're going to note for any pigmentation, rashes, scars, or ulcers. All right. Can I have you stick your legs out as far as possible? All right. Thank you. So there's no discoloration. There is a little bit of darkness on his kneecaps, but that's normal. People with darker skin tend to have hyperpigmentation across different areas of their body, so there's nothing that's alarming. Can I see your feet? All right. There's no ulcers or any bruises on his feet. Thank you, sir. All right. All right. So now we're going to palpate his radial and his brachial pulses. His radial pulse should be along the length of his thumb, so we'll palpate it just right about here. And then his brachial pulse should be along the length of his arm, so we'll palpate it right about here, or wherever we can really feel that brachial part, but that should be along here. All right, so can I have you press your hands? I feel a strong, healthy pulse, and I'll rate it about a 2. It's normal. It's not like anything that's super exaggerated, and it's not diminished either. It's just a healthy, strong pulse. So I'll rate that a 2. So now we're going to feel for his brachial artery, and it should be like right around the crook of your elbow. And you have to like kind of press a little bit harder depending on how the muscle or the fatty tissue on your patient's body is. All right, so I feel it, and I would also rate that a 2, which means that it's normal, it's not bounding, and it's not diminished either, so it's right there in the middle, so that's good. So next we're going to palpate his epitrochlear nodes, which should be just right about here, and if there's any like any raised bumps that you feel there, then those are your epitrochlear nodes. Can I have you flex your elbow 90 degrees? And then here is his medial epicondyle right here. So I'm going to, just about 3 centimeters from that, we're going to just palpate the area and see if there's any raised like lumps that you might feel. I don't feel anything, so everything is within normal limits. Thank you, sir. All right, so next we're going to assess his capillary refill. So we're going to press down on his nail, see if it blanches or whitens, and then we'll see how long it takes to fill up. So, all right, so we're gonna do his thumb. So that took about 5 seconds to fill up. It didn't take very long at all. So that's good. That means his capillaries are working as they should. Okay, so next we're going to inspect his femoral popliteal, dorsalis pedis, and posterior tibial pulses. All right, can I have you stand up? So the femoral pulse should be along the inner thigh, so that should be somewhere along here. So he should have a relatively normal pulse. My patient does not feel comfortable with me palpating his femoral pulse. We are not going to do that today. So next we're going to palpate his popliteal artery, so we can see if we can find his popliteal pulse. All right, so that should be all right. So I feel a great pulse. I'll rate that a 2. Once again, it's within normal limits. Nothing too exaggerated, and nothing that is diminished either. So next we're going to palpate his posterior. We're going to palpate for his posterior tibial pulse. So that should be like right here at the ankle, or around these ankle joints. a nice, strong, healthy pulse. That means my patient is okay. And I'll rate that 2 as well. All right, so now we're going to check his superficial inguinal nodes. Can I have him stand up? So your inguinal nodes are right along here, along your groin. So that should be along here on my patient. He does not feel comfortable with me palpating his inguinal nodes, so we're not going to do that today, but I'm sure they're fine. Okay, so now we're going to note the temperature of his legs and feet. You can sit back now, sir. Okay, so his legs. Have you check out your feet? Okay, and on this side, check out your legs. All right, so my patient's leg temperatures were normal. As I went down his leg, they felt colder to the touch, but that could really just be because of temperature changes in the air and things like that. But overall, my patient's body was warm and regular. So now we're going to be looking for the presence of any edema. My patient's legs seem to be normal. There's no swelling, which is edema is basically like the filling of your extremities with fluid. There's no edema along his legs. All of the veins look normal. There's no prominent like tendons or bones sticking out or anything like that. So everything just looks to be within normal limits. All right, so now we're going to be looking at the capillary refill in my patient's toes, and we'll see how long it takes for his toes to pinken back up. So. Alright, so that took about 3 seconds, not long at all, and that means that his capillaries are working perfectly fine in his toes. So now we're going to do the Allen test, and this is basically where my patient is going to make a tight fist, and I'm going to compress his radial and ulnar arteries. So his radial, which will be here, and his ulnar, which will be here. Those 2 arteries, and then I'll let one go, and then he'll make the fist again at the same time on the other side. Alright, can I have him make a tight fist? Alright, so I'm going to palpate for his radial and ulnar arteries. Alright, so I'm going to let one go. Now I'm going to do the same thing on the other side. Alright, so now we're going to assess my patient's arteries and his lower extremities. So we're going to test for arterial insufficiency. Basically, I'm going to have my patient raise his leg 60 degrees. Started to regain some color, and that took about 30 seconds, which means that his arteries are working perfectly fine in his legs. Alright, so that brings us to the end of today's physical examination. Thank you to Mr. Oge for participating in this